everyone. Welcome back to our presentation today. My name is Aishwarya. I am a pelvic floor physical therapist here from Pennsylvania. I wanted to talk today about some basics that the pelvic floor can help with people who suffer from constipation. Before I begin my talk, I just wanted to mention I'm here with Virtual Care today with a K, and we provide customized disease-specific individual sessions by physical therapists, occupational therapists, and speech therapists. I wanted to start today's talk with a little introduction on what exactly are the pelvic floor muscles. So if you look at the picture on the screen, the pelvic floor muscles are the muscles in red, which extend from front to back, and they're also from side to side. So if you want to think about a hammock situation in the bottom, that's where the pelvic floor muscles are. And as you can see on that picture, it supports the bladder, the bowel, the prostate gland in male, and in female on the other side it supports the bladder, the uterus, the bowel. So it's kind of like that underlying layer of muscles which pretty much supports all these organs on top. The pelvic floor muscles are like any other muscles in our body, like we have neck muscles and arm muscles. So they are skeletal muscles that can tighten and can relax and do all of those situations at the appropriate time to help us control the flow of urine and bowel. This would be a cross-sectional view of the pelvic floor muscles. So if you look at the openings, there is the opening for the urine, the vaginal opening, and then the rectal opening from top to bottom. And the muscles, like I said, span throughout the length of this opening, so it can help support and function for all those organs that we just saw in the previous picture. I also like to mention that the back, hip, so like your hip muscles, your lower back, your diaphragm, which is kind of like your breathing muscle, and the pelvic floor can all they all need to work together so we maintain this control that we need for the bowel and the bladder. So that's what I kind of had a picture here. So this is the diaphragm on top. Your pelvic floor muscles are on the bottom. The front is the abdominal muscles, and the back is your back muscles. And like it says on the slide, it supports all the organs so we can have good control of the urine and the bowel contents. So people generally ask me what is normal as far as bowel movements go, and it can be a little harder question to answer, but I just wanted to put this slide up here talking about, generally speaking, if you don't have a lot of other medical conditions and you're not on a whole bunch of medications, our stool should look like type 3 or type 4 on that screen, if you can see that. If it's too much towards the 1 and 2 type, that's generally rated as constipation. And then there's a whole bunch that we can talk about, like fluid and fiber, and how is the body functioning, which I'm going to get into. And if there's too much of something going on, then you can have diarrhea, which is like your 6 and 7. So optimal would be, or what we should work towards, is the type 3 or type 4 kind of a stool. And people will always ask me, like, how often should I have a bowel movement? Well, that's also a very difficult question to answer, because as you can see, there's so many factors that play into forming a bowel movement. So generally it's said that it should be 3 times a day for some people, to up to 3 times a week for some people. So as you can see, that range is a little too wide, but the main thing that you want to you want to focus on is if there is a sudden change in your frequency of having a bowel movement. So let's say you were somebody who used to go once a day, and now due to certain changes in your lifestyle or medication or medical situation, you're not going once a day and it's more like once in 3 days. There can be some things that we can do to kind of get you back to what your baseline was. So again, knowing what your baseline is, and if there is a change, working towards getting you back to your baseline would be one of the things that we could brainstorm and work together on. So, and then kind of coming into what would be the normal problems associated with having like any dysfunction in the bowel. So obviously the first one would be constipation. So this is where, if you go back to the previous slide, you have that type 1 or type 2 stool. As you can tell from that, it's going to be really hard to get that stool out. So you're probably going to be doing some straining, some pushing to get the bowel movement out. And again, the severity can vary. Like some people will say, I don't need to push as much. Some people will say, it's really hard for me to get my bowel movement out. So it can be kind of a longer continuum. But the basic thing we want to remember is it's hard to get the bowel movement out. It's not a very easy process. Some people can have incomplete emptying where they feel, I got some of my bowel movement out, but I still feel like there is more and I cannot get the rest of it out. This is also, and like I said, with all of this, we also want to kind of look at what else is going on in your lifestyle. How are we eating? How are we drinking? What is our medication looking like? Because side effect of many medications, including pain medications, could be constipation. So I'm just trying to simplify this, but we almost want to take a look at the whole system and see what's going on. And sometimes there can be kind of like your pelvic floor muscles and colon are not talking to each other very well. So some patients in this situation will present with like fecal incontinence, like where you have the bowel movement coming out, or you get a very short notice of urgency before the bowel movement comes out. Some people can have weakness of the pelvic floor muscles, so we're not able to control the bowel movement. So there can be a couple things going on, but we'll mainly focus today's topic on trying to look into that constipation and straining situation associated with having a bowel problem. I first and foremost would highly recommend seeing a pelvic floor physical therapist, because you do want to know in an individualized fashion kind of what are the contributing factors for you. This talk is generally more like an overview, but you want to make sure you're able to have somebody check and see how your muscles are contracting, how your muscles are relaxing, so that this talk doesn't take away from actually having to see somebody, but it would be a good segue into kind of what are the things you should look into. So typically, how does pelvic floor physical therapy help with this situation? Generally, a pelvic floor physical therapist will ask you in great detail about your history, should ask you about your low back pain, should ask you about hip symptoms, and then kind of work into that realm of what is going on with the pelvic floor muscles. So getting a good history can sometimes be a really key component of this examination and evaluation. They should also probably talk to you a little about your diet and your fluid intake. So going into diet, a little bit of a kind of like, what are you eating as far as fruits and vegetables go? How much fiber are you getting? Kind of just making a note of any medications that you're on. If you're on pain medications to manage some other pain situation, can that be a contributing factor? So we are just kind of like taking an inventory to look at what other things may be happening in the system that you're having this difficulty emptying your bowel. I typically like to ask for fluid intake because, as you can tell, to form a good bowel movement, yes, you need the fiber, yes, you need good nutrients in your diet, but you also need that water to kind of mix and form that bowel movement. So, if we're forming the bowel movement correctly, working the pelvic floor can help to get things out, but forming the bowel movement is also a key component of the benefit that you're going to have with pelvic floor physical therapy. So typically, if you don't have any other medical situation going on, you should be drinking about half your body weight in water. One way to look at this would be what color is your urine. So it should almost be light yellow to clear. You don't want it to be super dark. That's a rough estimate of making sure you're getting enough fluid in your diet. I have this picture up on the screen for what a colon massage should look like. So this is basically you're taking your fingers, working around the belly button to get some areas moving to see if that can help with having your peristalsis happening to get the bowel movement out. People who have had some surgeries, I can have like some scar tissue. The abdominal muscles can really be limited in their movement. Your diaphragm may not be working the way it should. So getting a little bit of the massage going on around the belly can be really helpful to get things moving. I will typically recommend my patients to do this at night before they go to bed. And one of the things that helps with bowel, in addition, is to have like certain times of the day that you're trying to empty your bowel. So we naturally have a reflux in our body that after we have something to drink, like maybe a warm cup of coffee or tea in the morning, 20 to 30 minutes later, you should typically have I shouldn't say should, it's expected to have a bowel movement. So if we can retrain our body to get back into that routine, it can be really helpful. So just doing a little bit of massage at night before you go to bed, along with some breathing. Wake up in the morning, drink your tea, coffee, warm water. Try 20 to 30 minutes after that to see if you can have a bowel movement. Kind of establishing that routine can sometimes be really helpful. In addition, while we're sitting on the commode, as you can see in the picture in the bottom, getting your knees higher than your hips and slightly leaning forward can help relax certain pelvic floor muscles, which can just make it easier for your body to eliminate the bowel contents. Many of you may have heard about the squatty potty. So basically, that's a step stool to get your knees higher than your hips. And I think I have a picture coming up on what muscle that relaxes. But basically, you're trying to open up the pelvic floor so the contents from the bowel can come in. Because if your pelvic floor muscle is too tight, it's going to make it really hard for you to empty the bowel. I also typically teach my patients what's the right kind of breathing to do when you're sitting on the toilet bowl. And I wrote down here blow bubble breaths. So that would look like this. You would breathe in through the nose. You would breathe out from the mouth, but you want to get your abdominal muscles working. So it's going to look like this. So breathing in and then go. So you're keeping your glottis open so there is not that pressure coming down into the pelvic floor, and the generation of force should be coming from the belly muscles, not with you holding your breath down. So again, from that previous picture, your pelvic floor muscles need to relax to empty your bowel and bladder. So if they're too tight, which is what happens when we're pushing or straining or holding our breath, that whole mechanism doesn't function the way it should. So using the squatty potty or like a step stool, getting your knees higher than your hips, just slightly leaning forward, taking some breaths in and going can be really helpful to avoid straining or putting that pressure down into the pelvic floor. We pretty much most of us already know being active can be really helpful too. Sometimes we've heard of people who have been post surgery or bedridden because of some restrictions they had, and then they have a really hard time having a bowel movement. So if you're up and against gravity and you're walking and you're moving and you're doing things around the house or going for an exercise, that can also really help keep things flowing and moving in your system, so things are not getting like stuck and we're facing the problems with constipation. So this is the picture of the muscle that we were trying to relax when we use the step stool. It's called the puborectalis. It's a part of the pelvic floor muscle. But if you're in that kind of like squat position, which is what happens when your knees are higher than your hips, you almost help relax that muscle. So it just makes it easier for your body to eliminate. I typically recommend patients to put their feet on something. You don't want to like crouch down or hold yourself in the squat position, because that's not going to help you relax your pelvic floor muscles. You definitely want to make sure your feet are supported and they're more relaxed rather than you holding your feet up, because that will not help you relax your pelvic floor muscles. So in summary, generally you want to try to get about 20 to 25 grams of fiber in your diet. Sometimes it can be really helpful to just track how much fiber we're getting, because if we are not very aware about the exact amount of fiber we're getting, I'll typically recommend my patients to just write down. There's so many apps that you can use. And again, 20 to 25 grams is if you don't have any other medical condition and you're not on a whole bunch of medications, that would roughly be where your fiber intake should be. But obviously, make sure you talk to your doctor and see if that's what is supposed to be for your health. We can all work on water intake for sure. So rough estimate, again, considering everything else is good in your medical care, would be half your body weight in ounces. Again, trying to use that step stool, working on your breathing while we're trying to get the bowel movement out can be helpful. Staying active, we all know, can be helpful in everything in life in general, but more so for the pelvic floor. People will ask me questions about laxatives and stool softeners. My patients will. And typically, you definitely want to make sure you're reaching out to your medical provider and they are aware about any other supplements or things that you're taking, so we can make sure you're doing everything safely. I really want to thank you for your time today. I hope this was helpful, and I wish you could join us in future presentations that we'll be having, and we'll give the information for that on Facebook. Thank you again for your time today.